All right. Good afternoon, everyone, and welcome to the May 2022 State Advisory Council meeting. Today, we are coming together to focus on the Vermont Early Childhood Action Plan, which is really serving as the center and the heart of all of our work in Vermont's early childhood system. I'm Dr. Morgan Crossman, and I'm the Executive Director of Building Bright Futures, which is Vermont's Early Childhood State Advisory Council. I'm also the mom of an almost 5-year-old who's about to transition to kindergarten and who has just graduated from her IEP for speech. So lots of things to celebrate this year. I'm joined by our State Advisory Council members and members from all across our network. But today, in terms of co-facilitation, we have brought together a range of partners to support the BBF team. So today, we'll be having Cheryl Wilcox, who's the Interagency Planning Director for the Department of Mental Health, and Flor Diaz-Smith, who is a school board member and a representative for the Vermont School Boards Association, both of whom are on the State Advisory Council and serve as the public and private co-chairs, and they're going to be making some brief opening remarks. So I'm going to turn it over to Flor and Cheryl.
Hi, everybody. I'm happy to be here. We're excited to celebrate where we have made progress and evaluate strategy from this past coming year to reach the goals in the Vermont Early Childhood Action Plan. I would like to start by saying thank you to all of you for your commitment to strengthening the early childhood system and improving the well-being of all of Vermont children, from prenatal to age 8 and their families. We're committed to building a system that provides equitable access and high quality services and supports for all our children and families. And now pass it on to Cheryl.
Thank you, Flor, and welcome to Flor as the new co-chair. It's really great to be co-chairing with you now. There are a few things I wanted to share about our work today. So, it's interesting when we think about the Vermont Early Childhood System and this action plan. I know, having been a part of this group for several years now, the commitment and all the voices, and that this is really our Vermont plan, that it's all of us, and that we're really looking at how we can be collectively accountable to achieve some measurable 2026 goals. It also, when we think about this plan, it's based on new evidence, best practices, our lessons learned, and also looking at improved analytics for identification and measurement of child, family, and system indicators. And I really appreciate the focus on data and what BBF has brought to the forefront in that way. Our goal is to make sure that every Vermonter is able to see themselves and their work represented within the strategic plan. And I think given the commitment BBF has made to bringing all this together, it feels like many voices are at the table and really lead into this work and the culmination of the VECAP. We want to make sure in Vermont that we are aspiring to realize the promise of each and every Vermont child by ensuring that the early childhood system is integrated, continuous, comprehensive, and high quality. We also want to make sure it's equitable, accessible, and is going to improve outcomes for children in prenatal to age 8 and their families. We're going to be dedicating the first part of the meeting to celebrating progress and monitoring of the VECAP. And then the State Advisory Council is going to have a brief business meeting from 2:30 to 3 today. Anyone is very welcome to stay on. We're going to be voting on the fiscal year 23 Building Bright Futures budget. And at that point, we'll do our roll call of our State Advisory Council members. Thank you.
Thanks, Cheryl. So excited to have all of you here today. Just going to pull up the focus of our meeting is around the Vermont Early Childhood Action Plan, which is our shared strategic plan. And so following our practice to have a mindful moment at the beginning of our SAC meetings, I invite you to take a moment of silence to consider how to reflect on your role in the early childhood system and on the 4 goals of the action plan as we kind of dive into getting more familiar with the plan and how we are doing towards those goals. So to consider, how am I an agent for change to achieve the vision outlined in the VECAP? How are we working towards these goals we set for ourselves? I'm going to take a moment for you to think about that, and then we'll keep moving. Thank you. I recognize that sometimes we don't always take the time to really think about how we are connected, and especially doing the systems work can be a hard shift, especially if we're moving kind of from operations and daily management to that systems work. So in some ways it's a gift to be able to set aside some time to be able to do this high level planning and connecting with each other. So thank you for taking the time. We are thrilled to have you here with us, and of the people registered, and we have folks from all different levels of the BBF network joining us today. So of folks who registered, we have 28% of participants identified that your primary connection to the BBF network is through the 12 regional councils. About 32% indicated that you are part of one of the 7 Vermont Early Childhood Action Plan committees. 18% are state advisory council members, and the remainder, about 22%, are other public and private early childhood stakeholders. So we are thrilled to have such a diverse representation with us today. I also want to give a special shout out. Oh, this is our infrastructure, one more slide. As you can see, 12 regional councils are really the foundation to the network. The action plan committees, the state advisory council, working at the state level, all working together to influence and make the change that we are talking about together today. A quick shout out to some of the leaders who are chairs and co-chairs of these committees who do this work as volunteers, and we are so incredibly grateful for your commitment to stewarding the work that is outlined in the Vermont Early Childhood Action Plan.
All right, so now we want to dive right into the VECAP Summit portion of today. And many of you will recognize the visual that we have here on the screen. And this is the visual that was created in the 2020 iteration of the Vermont Early Childhood Action Plan. And what we really tried to do here was, again, make sure that the child and the family are at the center of all of our work, and that we have goals that align to the different levels of change that we're trying to make, whether it's in outcomes for kids and families, at the community level or the service level, and at the broader system level. And this vision that we've outlined for the system by the year 2026 really is there to establish shared accountability. How are we all coming to the table and committing to the same goals and making progress and determining our role in making that progress, especially as we're prioritizing the youngest and most vulnerable kids and families in the state. So today's meeting is about rededicating our commitment to this vision, to these goals and the priorities that we set forth. And we will be breaking into small groups in a little bit to celebrate progress, strategize the coming priorities, and then where we've identified needs for policy change. It's really about inspiring each other, right? How are we refocusing and inspiring each other, recognizing each other's roles and responsibilities, where we have leverage points to create change, and how we're moving our system towards the goals we've articulated to do what's best for kids and families. In addition, today's about monitoring. Where are we right now? Where are there still gaps? And where do we need to prioritize our efforts for the coming year? And as we think about monitoring, as many of you know, it's a key role that BBF plays in statute, both state and federal, to monitor the strategic plan, to hold the vision, and to determine where we've made progress. And I think one thing that we want to name for folks in this room is that monitoring as a term, it's not the sexiest or most exciting thing that we do as a network, right? But it's one of my favorite activities because it's what allows us to actually advise. We need to know what's happening on the ground to understand how to make recommendations and how to advise. And there's so many different ways that as a network, we come together to monitor the system and advise. And we really see our regional councils as the folks on the ground doing the live monitoring of the needs of kids, families, communities, educators, providers. We monitor through data and outcomes, as well as programs and service provision as we think about how we're doing on a very large population level for kids and families. But what those two ways of monitoring the system don't provide us is really looking at where each partner or entity within our system has created change or worked to create change based on the VECAP. So today's meeting is really exciting because it's really us coming together to say, here's how we're defining progress towards the vision and the goals that we've articulated on screen here. And so we want to ask you a series of questions because this is not something that BBF or just the state of Vermont is tackling right now. Our counterparts across the country in states are using a range of concepts to say, how are we monitoring progress in the system, in each early childhood system across the country? And so some of the states that we've been partnering with or talking about these concepts with are measuring policy change, investment, partnership, the development of new programs, thinking about capacity and workforce, slots that have been created, or things like seamless navigation for families. And so what we want to do before we break into small groups is really prompt you to be thinking about how you identify change. How are you thinking about progress? So I want you to think about the following list of questions as you move into small groups. Where do you see your role, your individual role, your organization or your entity's role and responsibilities outlined in the VECAP? How is your work creating change in a specific area? Based on where you sit in your role, how are you defining progress or success? Is it about relationships? Is it about tackling a specific project or initiative in the next year? Have you centralized data and made it publicly available or thought about how we define integration and measure it for the system? Have you created policy change or advocated to create a change in policy and seen outcomes? Did you help support or create significant investment in a specific area that needed urgent attention? Was there the recognition that a specific area needed to be tackled in the next year? And who's driving the change in that area? So we're really bringing all of you together today to help us define the status of these goals, of these activities and strategies, and really determine who's responsible and how we hold each other accountable for improving our piece of the system. I want you to be thinking about how we name it, and how you can look at each of the different sections of the VECAP and self-identify where your work's reflected and how we can monitor change. And so at BBF, what we've really been targeting in the last couple of years is how we monitor the VECAP and how we bring together early childhood experts to support that work. Our responsibility really lies in goal 4. How are we creating the integrated, well-resourced, data-informed system? For us, it's about bringing partners together to monitor the work, determining where we see integration, where are there gaps in resources, and how are we supporting the state in using data to inform policy. And what we've recognized is that our goal 4 can't be a reality unless we're helping and supporting partners in meeting all of the other goals and strategies and that they're interrelated. So right before we move into small groups, we want to show an example of one of our tools for how we monitor the system. Next slide, please. So very brief shout out to all of the partners who are on the call today from our regional councils, our regional council leadership, our regional managers. Thank you for your work in this last year. What we know about our regional councils is that they are the folks on the ground actively identifying and elevating the needs of children and families. And they've just gone through a process of discussing what the annual priorities would be and identifying the most critical needs and gaps right now that are impacting kids and families. They've also done some work thinking about the leverage points and where there are opportunities to create change within regions and on a state level. So this of note, it's not that this process is final. We are in the process of engaging additional stakeholders for these top 2 priorities in the next month or so, but we wanted to show this tool to this group today because there's some really unique regional variation in the needs of kids and families. And it also shows where there's themes emerging that we should probably be considering as a state and what statewide approaches are here. So one of the things that you might note in this map that you're seeing on the screen right now is that 7 out of 12 regions identified family safety and mental health as one of their top 2 priorities. 5 regions identified early childhood workforce development, and 4 regions identified building resilience in children, families, and communities. It's also important to note that just because one of these topic areas didn't emerge in the top 2 priorities, it doesn't mean it wasn't on that region's list to tackle. We really tried to hone in on their top 2. So I also think it's important for folks who don't traditionally sit around our regional council members or around our regional council tables to realize that you are invited to attend these regional council meetings. It's really important that today isn't the only opportunity where we have an intersection between our strategic plan committees, our regional councils, and the state advisory council. We want you to be meeting with each other. We want you to be able to identify and know the regional leaders so that you can refer to this map and know who the point people are to reach out to if you're really thinking about statewide change. We really see today as a critical point in time to be breaking down silos. So thank you for being here today, and I'm going to turn it back over to Beth Trzanski.
Thank you. So we're really prioritizing our time in small groups today. We feel like that can, especially when we're meeting virtually, that is some of the most meaningful time together. And we also feel like to be able to monitor an action plan, no one person can do that alone, right? That is really the power of our collective work. And so we're working to get us into small groups as quickly as possible so that you can have as much time there as possible. So we've set up small groups with the purpose to clarify the vision set out in the VECAP. So really to essentially, we will have 6 small groups, and I will share those topics, and you'll be able to self-select through Zoom rooms and move yourself to that group when we're ready. And you'll be able to do a little bit of visioning with this group about when we're successful, what does that future state look like? So that we can really ensure that we are on the same page about where we're going, right? To then be able to use the plan as our compass. We also are going to use the time in small groups to mark progress and some accomplishments over the last couple of years. And then to have a discussion to guide purposeful action that consider the challenges that we're facing, policy recommendations that are needed, and outcomes. So we've tapped a few partners and staff as facilitators and note takers. And we hope that this process is just one way that we're monitoring the VECAP of many, as Morgan talked about, so that we increase our likelihood of this becoming a reality. So let me just share with you the themes. For those some of us are VECAP geeks, and we, call on the VECAP and have it up on our computer screens constantly. I don't expect most of you are in that situation, and that's okay. But this is your chance to really kind of dive in a little bit and really help us identify how are we doing and what do we want to focus on in the coming year, particularly at the tables where we're convening. So we've identified 6 themes that will guide our small groups, and these themes, access to basic needs will be group 1. High quality and inclusive physical and mental health services, group 2. High quality and inclusive early care, education, and after school programs, group 3. Family partnership and resilience, group 4. Workforce development is group 5. And group 6 is around systems integration for seamless experiences of families. So as we, so really what I'd like you to think about is, which group calls to you, right? That you feel like you would like to be able to talk about for a little bit of time this afternoon. But I'd also invite you to think a little bit outside of where you traditionally might go, because this is an opportunity to kind of build some connections with others that you might not sit around the tables with otherwise. And also, groups that may not have as many people that, because we're letting you self-select, the groups may be different sizes. So just think about which group you'd like to go into. We'll have about 45 minutes in these small groups. The facilitators will move you through a discussion, and those groups will be recorded, and we'll take notes so that the conversations can move into and guide our future work. And then we'll come back together and invite you to share, and particularly we'll ask State Advisory Council members to share where you see where the priorities in the discussion that you move to action. I see a hand up. Questions about this process, Sarah?
Is that my hand up?
Yeah.
Sorry, I can't see that. I don't have a question. Thank you, Beth.
Okay, awesome.
Sarah Morrison, I think.
Okay.
I'm sorry.
All right. So
now.
Do you have a question, Sarah?
Is my volume working now?
Yep.
So sorry, I was having some trouble in the beginning, so it didn't switch over to my headphones. I was wondering if you could just share this list of the groups in the chat so that we can remember where they are if we decide to switch during that time.
Yep. I see Morgan's going to paste that into the chat. So essentially, we're going to open the Zoom rooms, and then you can, in the black menu bar, you can select which group you'd like to choose. Group 6, however, if you want to be part of group 6, you don't need to select anything. We're going to keep you in this main room. Groups 1 through 5 will migrate into the other virtual spaces. So any other questions about that? Great. So we are thrilled to have you, if you have questions, hang back and we'll help you do that. All right.
Now we play the game of, at what point do we think people are here because they wish to be here and not because they just haven't switched to a different group yet? So I'm still seeing some movement. We'll give it another minute.
My name is Lee, and I'm in this group because I forgot that I have to get my daughter vaccinated with her booster shot. So I'm listening to you, and I'm going to be able to partake more actively when we're boosted.
Perfect.
Honestly don't see on my computer where I switch.
There should be a button near the bottom that says breakout rooms. I have not clicked it, but it should give you a choice to be able to select one of the others if you'd like.
Thank you much.
And if anyone else is having trouble, you can just let me know which other group you would rather be in.
Perfect. All right, I think we'll get started. So my name is Becky Millard. I am the Director of Northern Lights at CCV, which is the hub of the professional development system for the early childhood and after school workforce. I'm also the co-chair of the Professional Preparation and Development Committee. And I will be your facilitator for this afternoon. Dora, do you want to introduce yourself too?
I'm Dora Levinson. I am the Research and Data Director at Building Bright Futures, and I am here to support facilitation.
Fantastic. So unlike some other sessions we've had in past years, this one's a little more structured. So I am going to look to the side on my other screen. I've got sort of the directions laid out. when we started engaging in this in some of the smaller groups, I had a little trouble taking it all in auditorily. So I want to invite you from the very beginning, if there are things that you would rather see in writing, we can copy and paste some language from our sort of worksheet into the chat. Like, we'd like to make this as accessible as possible for folks. So please don't hesitate to let us know if you need something repeated or if you'd like to see something written. Let's see. So Dora, I don't know that I can record. Are you able? Oh, you are recording. Ignore me. That part's already all set. It says record to the computer on my list. So I wanted to make sure we were set there. All right. So as a group, we will explore how we are doing on a particular part of the early childhood system and what it takes to improve child and family outcomes. I think my favorite part of this is the direct linkage of trying to draw that connection between systems work and child and family outcomes, which is one of the reasons we're using this structured format. So to start, we're going to take a moment to understand our role and connection to the Vermont Early Childhood Action Plan, mark where there's been progress, and then we'll finish with forming some concrete strategies for the next year. So we've selected some key strategies in the action plan related to systems integration for seamless experiences of families. I gotta tell you, like, that particular goal really speaks to me in so many ways, that so much of the work many of us do when we're in the middle of our systems is trying to get at this place. How can we make this easier and better for families? So we'll put a link in the chat if you, so that you're able to, I think this should work, get you right to the Vermont Early Childhood Action Plan. If you don't have that available yet, this link should take you there. We're going to be talking about 4.1 and 4.2, which I'll tell you in just a second. But I want to give you a moment if you'd like to pull that up yourself so that you can read with me. So 4.1 is build integration at the state and local level to foster a continuous and comprehensive early childhood system. And goal 4.2 is develop a strong data infrastructure to enhance service delivery, systems building, and outcome reporting. So I know already that's a lot of words. So let me know if you need any of that, if you want to pause anywhere or need any of it in the chat. So to start with, we're going to take a moment independently to consider how your work and that of your organization is reflected in this strategy that we're talking about today. And I'm going to be quiet and let you think. That we'll probably take 2 minutes just to sort of think, and if it's helpful to you to write a few notes, what is it, how does your work and that of your organization connect to this topic? Okay, so we're going to take a step out of the present and we're going to imagine ourselves in 2026. Imagine that after 5 years of hard work and accomplishments toward this specific topic area strategies, what does the future look like for a child or family and how do they experience it? So we're circling back to, let's say, systems integration for seamless experiences of families. I just want to get the words right. I'm going to pop that in the chat. So we are imagining we are in the year 2026. There's been lots of hard work and accomplishments toward achieving this aim of systems integration for seamless experiences of families. And we're going to ask you to speak as if we are in that year. This amazing work has happened. Families are experiencing this really great seamless experience. Let's build it. What does it look like? What are some of those sort of present tense statements of what the world looks like? Counting in my head to give the introverts time to like process the request and then decide if they want to engage. Oh, Elisa, I'm sorry, I didn't see your hand.
That's all right. I'm an introvert, so I raised my hand. Hi, everyone. I'm Elisa Stolberg. I'm the Maternal and Child Health Director at the Health Department. I'm actually thinking about something that Morgan said at a prior SAC meeting about sort of not really being that families aren't really aware of all of the parts and the pieces. And that, you know, so the system is there, and maybe all the different organizations are together, but they're integrated to a degree that the family isn't having to sort of isn't even necessarily aware of all those parts and pieces, that they sort of hand off seamlessly, I guess is the right word, to each other.
Let me reframe a smidge just to make sure I'm understanding. So in this sort of picture, it's not necessarily that the families understand all these wacky components of the system that we have, but they know how to get their needs met so that those systems are actually working on their behalf to such a way that they know, oh yeah, if I go here, I'm going to be good. Or am I misunderstanding?
No, you hit it, because much of the reason that the parts don't work together, or part of the reason the parts don't work together, is around funding. And so people get sort of trapped into some of that. And so I think it's also about, no matter where you start, you can navigate through the system without that feeling of being fractured or having to repeat your story or what have you.
Great, thank you. Other thoughts? When you think about stories you've heard from families over the years, or things you yourself have experienced through systems, and you think, wow, you know what, if we could get rid of this thing, that would be better. Like, what does that future look like? What is the picture in your head of what it looks like when it's working well? Jim, go ahead. Oops, I'm not able to hear you. It looks like you're unmuted though. Pesky technology. Well, if you have something you want to pop in the chat, we can make sure to capture it there for sure. Dimitri.
Yeah, hi everyone. I'm Dimitri Garter, CEO of Global Z in Bennington, and I'm the business seat on the State Advisory Council. So a lot of the business perspective on this does come down to the funding, so it's hard not to view everything through that lens, but it's the easy answer is to say we need to pay for it. But there are also great concerns about equity of access, and without being a systems wonk on early childhood education and not understanding all of the components to get there. However, I can describe the solution that the business community really wants to see, which is that the system can be easily accessed and navigated regardless of socioeconomic status. There are great concerns about how accessible the system is today and will be in the long run by certain by everyone in Vermont, all Vermont kids. So equity of access is something that we are very, very seriously concerned with.
Great, thank you. So in the next few years, we've really dug in and addressed some of those barriers that currently exist, so that we're ensuring that no matter where you live, no matter what your pay status is in your family, that you have access to the early childhood education opportunities that you and your family need. That's wonderful. And I see, I think, yes, Jim's comment in the chat. So a system where a person enters the system where they want and seamlessly is able to access all the needs. So the no wrong door approach. Wonderful. And then Maria, the fear of being judged gets in the way. Helping parents know that the services are there to help. So the more the systems are out in the world, the more they see the benefits and not the judgment. I think that's a really excellent point about depending on what kind of services we're talking about. There's a lot of services that are available, but there are a lot of stigma that are attached to certain services. Thank you. Anne.
A lot of teaming goes on so that people can work that know each other well and can work in an interdisciplinary way.
Great, thank you. Maybe one or two other comments. Oh, I think I heard you, Jim. That's exciting. There's another comment in the chat. So letting parents know that the services can't be used up. It's not a process where you'd be taking services away from someone who may need them more. It's a system where the more people who need it, the more funding can come. I think that's a really excellent point that carries across many different aspects of our system of helping people access the resources they need. That concept of equity where everyone has what they need, which is going to look different for different families. Back to Dimitri's point as well, that some families need more. And that means that that's okay. And another family may need some more as well. And looking at our systems to adapt and adjust to meet families where they are, as opposed to thinking of it as a finite solution. It's great. Jim.
Also, I would think that adding to the no wrong door would be that no matter where you go, all of the possibilities are known to that location, so that that someone doesn't go to a wrong door and then encounter something where they need something, but that starting point didn't know about some other service that's useful to them.
It's a great point. So when we have a really fractured system, certain people may know about certain resources, but not about the comprehensive array of resources out there. So ensuring that wherever those points are along the journey that families may intersect with the system, that those places have real awareness of the array of services available. Great point, Anne. So the funding doesn't require us to use different language, write certain types of goals, or remain in our silos. It is amazing how much funding sources do sometimes trap us in the silos, even when we want to break free from them. Okay, so I'm going to invite you, if you have additional comments you'd like to share on this, please feel welcome to put them in the chat. I'm going to move us to the next piece of the agenda, but certainly if you have other things, feel welcome to share those. So the next shift we're going to look back to capture progress. So now instead of looking ahead, we're going to reverse back to 2020, which is, you know, a complicated year, I think, for all of us in the world. But thinking about, we have made a lot of accomplishments in our system from 2020 till now. And some of you are going to have really different perspectives on that based on where you are situated, which is awesome. So think about your experiences connected to the system, connected to families' experience of this system, and where do you see accomplishments that have happened from 2020 till now? So key accomplishments related to families' experience related to systems integration.
Hi, Becky.
Hi, Brina.
Really nice to see you. Nice to see so many of you familiar. I think in answer to your prompt, I'd pick up on what Anne said. I'm trying to think about the language that the different sectors use and how we all have a little bit of a nuance. Yes, it is because of funding. If you think about different funding sources want you to adopt different models and programs and ways of talking, and the way that we talk, I think probably sets up a fair amount of confusion for families. So some of you know I've become a touchpoints facilitator, so I'm back to the future in how do we as people that touch different parts of the system find a common language, or at least some threads, so that we're not shifting language to the confusion of our folks we work with.
Finding those opportunities for common language. And I think that's gonna, I think about Dimitri's point from a business owner perspective. I can't imagine how difficult it is to come into the early childhood world from the outside and try to parse all of the weird phrasing and language and acronyms and things that we tend to use. And I think if the more we can sort of find some commonalities in our language, I think we're going to make more sense to other folks that are connected to early childhood systems too. Great. So I see, Dimitri, key accomplishment, nearly universal recognition that access to childcare is essential for the well-being of Vermont's children and for a functioning economy. I agree. It's a huge accomplishment.
Becky Maria also had a comment in the chat.
Oh, wonderful. Thank you. Yes, more referrals were made for services for children. I don't have data on hand. So if anyone does have a link to data, we always like to know data sources too. If you have them, if you don't, it's perfectly fine. I think that's something that obviously a lot of people are keeping an eye on is trying to make sure that kids who need additional services are receiving those services. I have heard this as well, that we've had connected more kids to services needed.
Wendy, you had a comment in the chat about cross-state agency collaboration, and I'm not sure if that was the future or an accomplishment, or both.
Actually, both.
Awesome.
So we saw a lot more of state agencies pulling together because of COVID guidance. We had to work together. We had to pull together and make sure that the field knew what was going on, childcare and UPK programs. That's where I come from. And also, we do have more collaboration with CDD than we've ever had over the past 2 years, standing up our UPK legislative monitoring system called Access.
So for any folks, I'm not sure where everyone is coming from. So what Wendy's referring to is sort of the integration across the Agency of Education's early education team and the Child Development Division, particularly around universal pre-kindergarten. We have a complicated model, and it's been really exciting to see the agencies trying to find those pathways together and trying to make things easier for the workforce and for the families. Other accomplishments over the past couple of years.
Yeah, I know this doesn't work for everyone, but telehealth, adding an option for some families and early childhood professionals.
Thanks for that, Anne. Yeah, I think what we've seen is that adds another component in the system, another opportunity, another option in the system that does in fact increase access for a lot of families. And you're right, it's not universal, but it does increase and make that better. We saw that across professional development. We saw in many ways providing an online opportunity expanded access for many folks. Janet.
Awesome. Hi, Becky.
Hi, Janet.
Janet Kilburn here, Early Childhood Director at the Health Department. And I'll just share that we have made good progress in the past 2 years, largely due to the pandemic, for aligning our developmental screening and surveillance efforts. We rolled out the ages and stages questionnaire. It's called ASQ, but it's a developmental screening tool that we have consensus across the state for using, both the regular general developmental tool and the social emotional. And we started at the beginning, just like January before the pandemic hit, with 200 screens entered in that system. And now it's over 9,000 screens. And we've trained a variety of cross-sector folks, from childcare providers, early educators, pre-K. We have some school districts on board, early Head Start and Head Start sites, a couple CIS teams. I think 11 medical practices are now using that, and nurse home visitors. So what's so exciting is that folks, while they have their own ASQ program, those results are all going to go into our health department universal developmental screening registry, which is really, a whole population data source for screening, which we hope to link one day to the AOE state longitudinal data system. So we get that full story of what happens in early childhood, where folks referred and get connected to services, and then how are they doing later on at school age. So that's been very exciting.
That's awesome. Thanks, Janet. I think that also provides a great example of a connection across different sometimes people have extra silos when we're thinking of childcare settings, school settings, healthcare settings. And what's really exciting about the developmental screening is we're looking at that across many different settings, many different silos, and I'm really trying to share some of that information where possible and appropriate, which is wonderful. Great. Okay, I'm going to transition us to the next piece, but again, please, if something else comes to you and you'd like to share it, please go ahead and put that in the chat. So the next piece is around purposeful action. So as we're sort of thinking about where we've been, where we are, where we're going, what are some key steps that you think either ourselves or somebody else in the BBF network could take? Some of the things that may come up here are some of the barriers that we need to address. Like, what are some of these barriers, some ideas toward addressing some of the barriers that exist toward this future that we've imagined, policy changes that are needed, partnerships we need to build. So, as we think about the accomplishments so far, what else do we need to do to get us toward that vision we were imagining? And I would say, think about yourself and sort of the particular role and roles that you hold, but also really feel free to think expansively. Even if you're not sure who should be doing the thing, if you see an opportunity for something that could be done to move us forward, please do share what comes to mind. Go ahead, Jim.
So bringing down silos, one of the things I feel like inhibits some of the work is that there's sort of a territorial protectionism that sometimes people mean well, but it does prevent a common system. And so I think we could work on that.
Great. So when you think about the network that exists within Building Bright Futures, do you see opportunities of individuals or committees or particular types of work BBF could engage in to help break down some of those barriers?
I'm thinking of it in a larger sense than
sure.
BBF. I think that there are different departments or regions that I think sometimes can get caught up in that. I don't mean it in a bad way, because I think those things come from, say, meaning well, but awareness of it. So interagency, interregional kind of thing.
Yeah, thank you. So one place I see, and Dora, I'm not sure if I've got the right name of the committee in my head, but the sort of interagency coordinating team. So there's one of the BBF statewide committees is agency and division leadership from across the state who all have some connection to lens on funding toward early childhood topics. And often those are the decision makers in the room together that are coordinating various parts of the system. So in my mind, I wonder if that's a topic that could be lifted to that interagency coordinating team to really think strategically about how can we break down some of these barriers that might exist due to sort of turf issues or holding on to older ideas of what the system used to be, and sort of how might we think about working with folks to have a more expansive view of where we might go next. I'm not sure the framing, it's all kind of complicated, but I do think there is a team on the BBF network that might be a great place for that conversation. Other thoughts? And I see Dimitri has a comment in the chat. So advocating for investments in data infrastructure and strong governance systems. These are tricky things to fund. So I agree. I think advocating for those investments is really important. Going back to the objectives, transparency and predictability in cost of investment, how the cost is distributed and how the investments are correlating to outcomes. These are tricky in our early childhood world. It's really difficult when we're trying to link, here are the dollars you should spend, and then we're looking at child and family outcomes because there so many things impact child outcomes, right? It's not as easy as we can't make a one-to-one of like, obviously spend these dollars and everyone will be better off. It's a harder story to tell, particularly for folks who are used to a different world. But I think we can't stop. We've got to keep advocating. We've got to keep telling that data story in particular.
Yeah, Becky, if I could just add that.
Please, absolutely.
Yeah, absolutely recognize that it's hard to make a direct connection between the investment and the outcomes. But that's where the transparency and the predictability are really important as well. And that's, yeah, I think the key, you know, we have very big concerns about the costs and how it's going to be allocated.
Sure.
I think the way to get through that is to ensure that transparency.
And I think this ties back to the system conversation too, of the more that various system partners and leaders can be as transparent as possible about the why behind the various things that are happening, the better for everyone, including families. The more we understand why the heck are these two fingerprinting things existing in separate systems. And when we can talk about the fact that it's a federal government issue that trickles down to states, it can lower people's frustration. Similarly for family interactions, if we can explain the why behind certain frustrations, it can help lower some of the frustration and help us sort of flip to a problem-solving mindset. And I do think the better we can tell our story and the better we can explain what's happening, where are the challenges, and how are we going to move them forward, helps across the board. Dora, did I see? Yeah, go ahead.
Yeah, I just wanted to say that, you know, there is so much work happening across committees of the BBF network and clearly outside, that there is the Early Childhood Investment Committee that is coming back together. There's this initial draft of an early childhood budget to sort of address some of the things that you're talking about, Dimitri. Like, it is so important to be able to have that transparency and accountability, and that when we think about this larger vision that is the goal and vision of the VECAP, how are we monitoring all of the strategies so that then if they're not working, that we are able to adapt them, so that we can see where those dollars are going. So again, there's an Early Childhood Investment Committee, data and evaluation for sure, thinking about that infrastructure. It is amazing how some of the things that we want to be able to track, to be able to say, you know, we're spending this much on this program. How many kids are enrolled? Like, that feels like a relatively low barrier, low burden, and we still aren't able to do it. So absolutely happening at those two committees, and again at that early childhood interagency coordinating team meeting.
Great, thanks, Dora.
And just to build on that and what Dimitri was saying, I haven't been there recently, but the Data and Evaluation Committee did a lot of work on data governance. And I think where we landed, Dora, you chime in if my information is outdated, that we really need to go back to staffing for that work for it to move forward. So all of the structure is there, you know, who needs to be part of the advisory group, all of those things, but we need a staff person to drive it. Mm-hmm. So hiring someone to do that work.
Mm-hmm. Thanks, Anne. Yeah, I think that's a really great point that, you know, there's a certain amount of our work that makes sense to live with volunteers and to live with those of us who are able to contribute some of our work time for a different organization toward the outcomes and objectives of the Building Bright Futures Network. And there's that threshold at which we need to have certain staffing capacity for certain components of the work in order to do it well. Thanks for raising that. So when you think about interactions you have with families or that you have historically had with families, imagine we're trying to head toward that future we envisioned. Think about obstacles or challenges they've experienced, and do you have ideas? Like, what do you have in mind? What could help? What could improve? What could make their things better for the interactions the families are having with the system? We've had several, which is wonderful. I just want to see if some of the rest of you have other thoughts you might want to add about what are some of those purposeful actions we could take in the next couple of years toward an improved system that works well for families. So one thing I want to make sure you know about is the Families and Communities Committee that exists as part of the BBF network. There's been a lot of really excellent work over the past several years to try to make sure that that committee is really representative of families. I think one of the things that's a little bit of a danger in the systems work that we do is when you have a family representative, like one person who's supposed to represent all families, or like a token representative, or somebody who works in the field who is also a parent who's trying to hold both of those hats. So one thing I've been so excited to watch with the Families and Communities Committee is the intentional cultivation of relationships with families, with folks who want to engage in some systems work and are directly coming in with that lens of parent, guardian, caregiver into the committee work. So I think it's just some much more representative opportunity. Families who participate don't have to feel like they are some sort of token representative either. And it's been really exciting to watch the evolution of that committee. So I know from the Professional Preparation and Development Committee side, we are really excited to have access to that committee when we have certain questions that come up for us and we want to seek out some perspectives from various family members who are participating in the system. So I want to note that in the pause, in case make sure that you all know that that exists as an opportunity and resource that's within the system. So we have a couple more minutes. I do want to invite any last comments before we transition back. Could be on this purposeful action piece, could be something else that you've been kind of pondering and want to make sure you get a chance to share before we close out. Great, so a couple things in the chat here. So we've got data governance to allow data sharing and analysis of cross-sector work. Love that, that would be so amazing. Continue to ask families directly for what works for them and then act on their recommendations. Avoiding the deciding for them on their behalf what's going to work best, but instead actually asking families. Wonderful. A thought would be to hold free conventions or meetings that would educate families on what is available for help in the state from every department, or a convention that touches the new grads going to work in the field with communities to help them know the services and not stumble onto it once in the field. So that's a great idea. So some thinking about proactive solutions to make sure folks who need the information about what's available so they can share it with families have access to that in an ongoing way. Parent on the committee, oh wonderful, great way to feel engaged. Love to see more diversity, especially from non-native Vermonters, refugees, marginalized communities, etc. Thanks so much for that, Sarah. I do think that's an effort on all of our committees to really always be thoughtful and intentional about, do we have the right people around the table, and how might we make sure this is an inviting space to invite more diverse voices to that table. Universal enrollment forms where possible, that's definitely something I'd love to see. Wonderful. Thank you all for engaging in this conversation with us. This can be a little tricky to sort of try to situate ourselves in a present, a past, and a future, trying to sort of imagine. But we're also, this only works if we've got many different voices from many different perspectives coming together to be like, how are we doing? What progress have we made? Where do we need to go next? So thank you all so much for sort of engaging in that conversation.
And we are just about to wrap up in just a minute or two, and just thinking about some of the key actions or steps that we went over in this last section. I captured sort of the needing to break down barriers, thinking about that interagency coordination, universal enrollment, thinking about investments in data infrastructure and governance systems, thinking about data governance specifically, family in terms of partnerships, family representation, and marginalized communities, refugees, and making sure that it's not that token that families are really being asked directly what are their top needs, and then acting on those recommendations. Also, this very concrete idea about conventions that would educate families on resources that are available, or professionals thinking about going to work in the field. So really just having that same foundational level of understanding. So those are some of the things that I captured in our notes for those actions. Some are definitely very sort of big picture, and then there are some very concrete. I think about something like the universal enrollment forms. That is a very concrete, not simple, not easy, but it is one step that we can think about as part of these larger integration efforts.
Thanks, Dora.
Oh, thank you all for this. And everyone is coming back into this room in just a moment. Thank you to Becky for facilitating. That was great.
Ooh, Fast and Furious. Yeah.
Is Matthew. Thank you for the discussion and conversation about having this, so we can move forward and broaden and widen the scope of our work, so we can actually achieve that goal that we all been looking for. Thank you very much.
Thanks, Matthew. Yeah, I would love as groups come back together. It's great to see so many. I was in the high quality access to education and early education after school group. Would love to hear from folks. We'll let the State Advisory Council members lead off, and would love others to either share their reflections in the chat or hold on. And if we have time, we'll move on. But to consider what key accomplishments and priorities you heard that you're most excited to steward in the next year through your own work. So SAC members, if someone is moved to share to start us, you could use the hands up signal too. That could also help since there's so many of us. Cheryl, go ahead.
I wanted to get my hand up quickly while it was fresh in my brain. So I think some of the discussion we centered on that I'm really excited about regarding accomplishments and moving work forward. Certainly seeing a rate increase for mental health providers was a testament to the work they're doing, and feeling like it's unfortunate we had a pandemic to really elevate the needs of mental health, but it also is something that came out of that. And so there's been a lot of discussion about that. I think also more understanding, we were the group talking about integrated mental and physical health, and it's something we've talked a lot about, and feeling like we may be at a tipping point where folks understand more what that means, and that physical and mental health are completely tied together. And now it's a matter of how do we make sure that we have more of those integrated supports and the ability to do warm handoff back and forth. So mental health providers being able to warm handoff to primary care physician and vice versa. So really wanting to see that work move forward, and the partnerships we have to be able to elevate and move forward together.
Thank you, Cheryl. Others? Go ahead, Flor.
Because we had a really lively conversation in our group I was on the workforce group, and I think a couple of things that I'm excited to work on about policy. There was a great awareness of a pay difference between our public educators and our early childhood educators, but that came into a broader conversation of prioritizing and really creating more of a systems approach from 0 to 8, but 0 to 22, how we are all interconnected in that work. And last, we talked about the importance of creating opportunities for early child educators in our new Americans too, and creating paths for that to diversifying, not just the educator workforce, but at large our workforce too. And I'm probably missing a lot, but those were a couple of them.
Matthew, go ahead.
Yeah, thank you. I'm going to add to that. It's more about, it's for me to be vulnerable and openness about, professions of color, BIPOC communities, like what she said, is that diversifying, that unity of, we all have a part to play in participation within the educational system of Vermont. For me, it's like, that's hard. For me, it's hard to sit there and say that it's being ignored. It's hard for me to sit there and say that, the professions of color, are reaching out, more and more broadly moving forward, not just currently right now, but more broadly into the future. Because for me, it's hard to express that, my vulnerability as a person of color, as someone that, experiences myself, that the systems that is helping us is also has some biases preventing us to move forward in general, not just the workforce, because that affects everyone involved in this work. It's about, how can we be really inclusive throughout the education system so it doesn't hurt anyone else? Because when we're not all participating, it hurts everyone. And it's just not me in general. It hurts you. It hurts your neighbors. It hurts your families. It hurts your providers. It hurts your home childcare centers too as well. For me to share this experience with you guys is an opportunity to understand, to really understand that person's not emotions, but also what they're trying to say, what they're trying to bring to the table. And it's hard for me to sit there and say that, oh, we're doing enough, but are we truly doing enough to cover these, bases going forward? Are we truly being that inclusive, what people are talking about, for people to be more involved? Thank you.
Thank you so much, Matthew, for one, being vulnerable and being able to speak up in this setting, for being willing to ask the hard questions and to name hard things for the group to really be tackling, and for really thinking about what it means to have collective impact. It's not about any one different individual person, entity. It really is that we are trying to create systems change, and what impacts one is going to have a ripple effect. And how are we really thinking about systems change as a group? So thank you. Becca.
Our group talked a lot about relationships and capacity between organizations. We talked especially about the excitement of having people come into the field and the need to really capture them and make it possible to stay in Vermont, but stay and feel really supported in this field. And then our group really got into this question of how do we maintain all of the good work that we're doing, and build it within our relationships. And then we talked about all the loan repayment, and the identification that, particularly through the pandemic, the identification of early childhood as a profession that we're out there.
Thank you, Becca. Other groups that we haven't heard from yet? Does anyone from the families and resilience group want to take a shot at summarizing? Thanks, Ruth.
Sure. Thanks, Morgan. So the Family and Resilience Group, we first talked about what we wanted to see for families in 2026, and then our progress over the last few years. And even though there was a pandemic and still is, we have seen progress over the last few years, including more families being active ambassadors and having seats at the table, the integration of data and the identification that data is an important thing, the importance of lived experience, and the identification that early childhood work and families are extremely important. And the pandemic sort of underscored that for everyone. Key steps moving forward, to build on what Matthew was saying, we identified diversity of family representation in this work, and a better definition of what resilience actually means, because it's a word that's a little overused. I mentioned the governance and financing work that's happening, and how that will impact families. And all of us getting on the same page with goals. That may be an impossible task, but something that we're going to need to do more and more over the next couple of years as we try to do this work about systems change. We also identified the fragility of our healthcare system and mental health care system as a thing that really impacts the resilience of families and the stability of families. That system has been really challenged over the last few years, and we need to make sure that that's shored up in order to have healthy families. And a conversation about public-private partnerships and what employers need to be doing to support and really make it an expectation that families will be supported through their work. And we ended with talking about sharing good stories, because the world can be a sad and depressing place, especially recently. So we want to make sure that we're often leading with good stories instead of leading with problems and saying, here are all the great things that are happening. Here are the ways that families are successful, and how can we build on success rather than focus on problems. So I think that summarizes it. Thank you.
Great summary. Thank you, Ruth. All right, let's open it up. Other folks that want to share a couple of different observations or exciting takeaways from your small groups.
So Morgan, I'll just say that our small group was discussed. I'm trying to think of who did that, but I'll just, a couple of quick things that didn't come up. One is that really moving, we tried to look at what could the future look like. So what can we build on, and moving towards an enrollment system versus an attendance system, just like parents throughout Vermont have to pay no matter if their child is there or not, that we as the state should also be doing the same, so that our providers can rely on that. The other thing we talked about was the importance of building on the great work of both Building Bright Futures and Let's Grow Kids, as that we need a joint services place, a place that can help us with the administrative pieces, that can look at the system overall, that can help in all that we do as early educators, to take away some of those administrative high points. We also talked about the increase in reimbursement rates for our children integrated services that really can help us with mental health, that can hopefully, if we start early in those areas, then maybe by the time these children get to our schools, that it will be much better for them and much better for the system overall. So those were, I mean, we talked about paying our early educators, commensurate with what our public school teachers are getting paid in K through 3. So a lot of things that we hope the future will hold that I think we spent some time talking about.
Cynthia.
Thanks, Morgan. Our group was focused on basic needs, and I think some of the key takeaways that we really talked about was trying to help our state really prioritize, both from an investment and a legislative perspective, supporting basic needs for all. And while we have some really great inroads, and I think that the pandemic has shed some light certainly on housing needs, on food security needs, but we talked about the potential there is if we focus upstream a little bit and help families with these basic needs, then mitigating some of potentially those mental health needs, building resilience in families might become easier, especially for our early care and education workforce and our programs. So really thinking about, how do we prioritize these basic needs, and what have we learned from the pandemic? There are food security, child nutrition program waivers that have been in place that might expire. And our state has been really creative in thinking about universal school meals, but what does that look like for the early care and education sector? For housing, where housing and food security intersects, what have we learned from some of the system barriers and some of the stories that we've heard? Unfortunately, they have been tragic stories, but what can we learn to untangle some of those system pieces, and how does our legislature and our state agencies react to hopefully improve maybe some of those upstream services, and with an eye toward supporting basic needs.
Thank you. Anyone from the systems integration for seamless experiences of families group want to share?
I can start. We talked about a lot of different things, of course, and some of the things that we talked about moving forward were around continuing cross-agency collaboration. There has been an increase through COVID around protocols and the UPK monitoring system. There has been this start, and really continuing that cross-sector, cross-agency collaboration. Of course, we talked about investments in data infrastructure and governance systems, thinking about transparency of funding specifically. We also talked about the real need for true family representation, not in a token way, but some of like the work that Families and Communities has done, making sure that that the family voice is really is valued in as with that expertise. What have I missed from that group? There was a very specific item about having sort of a making sure that everyone knows what resources and services exist. So whether that is sort of I'm trying to look up a convention that makes sure that everyone is on the same page about what is available and how to access it. So very like something concrete like that. There, Dimitri was pointing out that there are lots of individual resource advisors for different things, but does everyone know how to access those resource advisors? So trying to think about that from an integration standpoint as well.
Thank you, Dora. It's really interesting to hear that point come up too, because I know that our Families and Communities Committee and our parent ambassadors are in the process of developing, from a data perspective, a family engagement assessment to really understand families' experiences with navigating services and what they have access to and how they know about it. So we will have more information on that, but I think it's really something that we need to be thinking about concretely in the next couple of months and throughout the next year. Any other exciting opportunities or areas of priority for the next year that anyone would like to share before we wrap up for the day? Go ahead, Matthew.
Exciting priorities and what we can do for next year is, for me, is just, continue what we're doing to service all families and try to, to integrate each of these systems in a way where it's inclusive, truly inclusive. Like the last person that said answered a good question about, is it really truly inclusive? Are these parents really getting the accessibility to these services that they need? Should there be an oversight committee? Should there be, a committee of, of citizens that could help out, with that workload moving forward, so they can actually, know if these systems are actually truly working for them? Because it could say accessibility and then there's availability to it. But there are some, barriers to access that accessibility components of the system. And as a whole, there are some accessibility barriers to them. It's just, they're just not, either they're limited funds, or they're just, you have to go through tons of loopholes or hoops just to attain these services. And it just, moving forward for priorities is just making sure it's accessible for everyone to use. Clearly, teachers, providers, home health, it should be accessibility for all, not just limited on the system itself. Thank you.
Thank you so much, Matthew. And your statement is really reminding me of our initial statement and the vision we've set out for Vermont's early childhood system. And I'm wondering if we're actually missing the word inclusion in that statement. And I think, one of the things that I think about in bringing all of these partners together today is, yes, we have this amazing strategic plan in place to monitor the system, and it needs to be adaptable and flexible to move and to be a living document, and something that we are constantly working in a continuous quality improvement cycle to build on. So I'm thinking about how to do that for the next year. Heidi, go ahead.
Yeah, the other thing I wanted to say as far as accessibility is to make sure that we have providers. So to make sure that we're pulling enough of the whole educated workforce, and not just the childhood educators, but also the PTs, OTs, our mental health and speech providers.
Thank you. Great point, Heidi. All right. So, to wrap us up for today, I just want to say, I really appreciate everyone coming together and taking the time to pause and actually celebrate successes. This is something we talked about in our small group a little bit, and that we have all been moving so fast and at such a quick pace over the course of the pandemic that we don't always celebrate where things have gone really well or where there have been significant accomplishments, and actually monitoring that progress and those successes to then determine where there are still gaps to then figure out how in the next year we move forward. And that was the purpose of today's monitoring activity. Where are we now? How far have we come? And where are we headed? And if we can agree on that vision and where we've made progress, it'll help us identify those priorities for the coming year. And I really appreciate the regional council partners who have really spent time, very intentional time, saying, this is where we are right now. Here are the needs of kids and families. And I want to invite everybody at every level of the State Advisory Council network to be able to be in touch with partners across the network to identify and continue thinking about those priorities as we think about setting recommendations for the coming year that we then ask the State Advisory Council to endorse later in the fall. How are you looking at the work we've done today, thinking about what your role is and where you've seen progress, but what you as an entity, as an individual, need to prioritize in the coming year to continue moving towards the vision that we've outlined in the strategic plan? So thank you all for coming today. We really value your input and the discussions. And if you would like to be involved in another level of the network, but don't know how, please reach out to any member of the BBF team. We can put you in touch with regional councils, with VECAP committees, or the State Advisory Council. The State Advisory Council is an open public meeting, so we want you to be there and we want your voice there. And if you are staying for the State Advisory Council meeting, we are going to take a 5-minute break and then reconvene to do some SAC business. So thank you all for being here today, and we'll see you soon. So State Advisory Council members, you can pause your video and we'll reconvene at